I was diagnosed in '99 after a general medical at the hospital. The following day the GP rang me up and indicated that he would wish me to see a specialist, and volunteered to make the appropriate arrangements, which he did. And 40 minutes later the phone went, and the lady on the phone said, Mr. Bradbrook would like to see you tomorrow morning at 9:30. So within 24 hours I was sitting in the urologist's consultant's chair. He then did a physical examination and confirmed that, to me that I had prostate cancer. PSA was 96 and rather advanced for, and I think it was probably phase 3. So it was a bit advanced and getting near the skin of the prostate, so it was decided that the operation would not be appropriate. So virtually I had to go down the route of the radiotherapy, which of course in those days we didn't have the conformal therapy that we have now to shape the beam of the radiotherapy into the shape of the tumour. My wife has been the anchor to a degree, to a large degree. And she's been so supportive, it's untrue. But what we did, we resolved that we should carry on life as usual and not go away from all these things and turn our back on it. It was a reality which we had to confront, and which we did. The subsequent treatments I've had have impacted it, and of course we are restricted in some ways on holidays, for instance, because of the urostomy. And it's a relatively new thing, so that we are a bit nervous about going long distances, but it doesn't really restrict us in our activities at all. And I go all over the place, to be honest, and car journeys and what have you, and it doesn't sort of impact or make any difference at all, really, except that we're always aware that I have to have my gear with me. As chairman of the local support association, I talk to many people, and they ring me up, and I can sort of explain and overcome their disquiet quite readily, really, and I'm quite happy to do so. And over the years, having talked to so many people, I'm aware of the various treatments that now exist, which are in the region of 8, whereas when I was diagnosed originally there was just the 2 alternatives, which was the operation or the hormone treatment, together with the radiotherapy. Well, go immediately to the doctor, there's no question about that. Explain the problems that you have and the concerns that you have, and he will react to those concerns. And then, if necessary, refer you to a consultant of whether it's urology or oncology. It matters not. But just insist that you should see someone if you're really concerned about it.